how do babies get fed?
I know.
How do babies get fed?
From your boobs. When babies get food from their mom's boobs, because when they don't get food, they'll be crying.
What about bottles?
They get milk from their mom's boobies to put it in the bottle, and you use a mommy breastfeeding pumper.
Okay, so we have 2 lactation appointments in home that we need to triage, so we need to get somebody out there as soon as possible. And we are booked from 12 to 4. So if anybody calls, their soonest availability is either at 11 or 5 o'clock, okay? I'm going to head into the support group, all right?
Okay.
All right, ladies, time for the support group.
You know, being a new mom and just trying to get used to my daughter, and you know, it was hard, but I still breastfed, but she would feed a couple of minutes at the beginning, and then she would latch off, and so, you know, we had to do the supplementation.
Making sure that, you know, they're latched on properly and the time that it takes, you know, 15 minutes each side for the beginning and every 2 to 3 hours, you know, waking her up.
I've had mastitis 3 times.
They're getting hungry more often, so they're waking up in the night a little bit more often, especially down the line. You know, when formula-fed babies are sleeping 6 or 7 hours, you know, breastfed baby might only be sleeping 3 hours at a time, and so that's difficult too. You know, I think that it's a lot of hard work. Now, how's the breastfeeding thing going?
Wow, pumping. I wish I would have taken a class. That was a new experience.
This is Jennifer. How can I help you?
The lactation consultants in the hospital are spread so thin that when a lot of moms did need help, you know, it was like, let's see if we can get a lactation consultant up here.
Well, I've had some concerns about how much she's actually getting from me while breastfeeding, because unlike a bottle, you really can't measure it out. So I really love coming to the support groups and having the pre and post weights to actually tell me exactly how much she's eating.
I wish my doctor would have talked to me more about breastfeeding.
My OBGYN never discussed, pretty much, she didn't even really want to discuss what was going on in the pregnancy until it was happening. So when I would ask her questions at 12 weeks, 16 weeks, she didn't even want to discuss what was going to happen at the birth. She wouldn't even entertain my questions until I was further along. And she never once mentioned breastfeeding to me.
At Coast Community Hospital, there's an 88% initiation rate for breastfeeding, but only 2% of the moms leave exclusively breastfeeding.
I think people are too lackadaisical about whether or not someone decides yes or no. They kind of, I think, do you breastfeed or do you not? And if the answer is no, okay, fine. I think people sometimes get worried about making moms feel pressure, or that they're going to be judged if they're not breastfeeding, so they just kind of, okay, you decide to formula feed, that's fine, and they don't, you know, try to provide extra information about, you know, the benefits of breast milk, you know, for the baby.
And I have run into a lot of breastfeeding moms that are doing, obviously, breastfeeding and formula, and I kind of wonder, like, where did they get that information to do breastfeeding and formula? You know, was it when they left the hospital and postpartum, or was it their pediatrician when they went to see their first checkup? Like, what is it? Who is telling them to supplement with formula, and why? Because it's dangerous when you're breastfeeding. I mean, pretty much I think at that point, it's hard to keep up your milk supply.
Any woman that has any sort of breastfeeding issues needs to, as soon as they get out of the hospital, contact a lactation consultant, check, you know, locally for a breast support group, and go.